The governor's top health care priority is infant mortality, and the speaker currently has a bill called the Safety Pin Bill addressing infant mortality. So we're up here talking about one of the areas that is disproportionately hit by this problem, Lake County, to figure out how we can better improve our infant mortality rates in Indiana and where to direct those services.
And we invited the Health Commissioner, Dr. Jerome Adams, up here today to talk about their efforts in infant mortality. Lake County, this region, Lake and Porter, has a large percentage of infant mortality, and we need to concentrate on this area. And today we got some invaluable information about what has been happening and what we can do.
I'm Matt Burden. I'm the Executive Director at Swanson Center, which is the mental health and addictions provider for LaPorte County. You know, one of my key interests in this is obviously being the mental health provider in LaPorte County is mental health and addictions in that role. A lot gets talked about with smoking and the effects of smoking, which is very important, but there are also alcohol, other drugs, as well as stress and depression that can cause not just infant mortality, but low birth weight, which leads to infant mortality. So I'm concerned in aspects of integrating care across the mental health and addiction spectrum and into primary care, and working in partnerships with OBs and neonatologists and pediatricians to try to come up with the best whole health for those kids.
We certainly want to lower our smoking rates and address obesity. Along with infant mortality, those are our top 3 priorities within the state, and we're going to be coming back up here to talk about initiatives related to those other 2 ideas also. Infant mortality is a proxy for so many other things. It's really a proxy for healthy communities.
I think today's conversation was important because in Northwest Indiana, we actually have higher rates than the rest of the state in terms of low birth weight and in infant mortality. And Indiana is actually one of the highest states in the nation. So we're really dealing with a problem up here that's even more extreme than a lot of other Hoosiers.
It's about bringing together community partners, bringing together people who traditionally haven't spoken to tackle this issue so that it can be part of a larger initiative to improve the health throughout the state.
Major partners should be the schools, the health commissioners, and community groups that deal basically with the pregnancies and pregnant mothers.
I'm excited. I really am. And I'm excited because we've got our Labor of Love campaign, a public relations initiative to educate people about the problems and directing the resources. We've got the governor who committed $13 million in his proposed budget, and we've got the speaker who's pushing a bill through the House. So we've got attention on this issue. What we need to do is get the right people in the room so that we can galvanize that attention and focus it in the right direction to improve the health for Hoosiers. One of the things the public and community should know about is that the Black infant mortality rate is almost 3 times as high as the white infant mortality rate. And that's not to say that we don't need to address this issue across Indiana and across races and across spectrums, but we particularly need to reach out to those problem communities. And I say problem communities, it's not their problem, it's our problem. We're not providing them the resources they need, but we need to figure out how we can better touch them to improve this statistic that unfortunately paints us in a bad light. The governor, the legislature, the State Department of Health, we're committed to helping, but really the solutions need to start at a grassroots level within the community. And we can provide the expertise, we can provide some of the startup funding to get things going, but if we want things to be sustainable and be successful, it's really about community partners getting together to figure out what's going on in their communities, what the root causes are, and to address them. Infant mortality is just one of the indicators that we're bad on in Indiana and up here. And it all goes back to connecting people to services. The work we do today will continue through tomorrow and the foreseeable future. It's not just about infant mortality, it's not just about infant morbidity, it's about healthy families, it's about changing the whole way we look at and deliver health care and community health.